MDMA supported psychotherapy is coming, and it is important that you know about it. We haven't had innovation in mental health care for almost 30 years since SSRIs, or selective serotonin reuptake inhibitors, hit the market and became one of the most prescribed medications in the world. We are in the midst of what we might call a mental health crisis. We've seen the suicide rate in the United States increase 30% between the years 2000 and 2018. Depression is the most common cause of disability across the world, and we see lots of hours of lost productivity, creativity, and participation because of mental health concerns. So we could argue that humanity is not doing super well, and we haven't had great tools or ways of thinking about mental well-being that have really turned the tide on this problem. I personally am excited about the potential innovations being offered by psychedelic-supported psychotherapy. These are a set of practices that integrate therapy alongside of a medication. Psilocybin is one, that's the active ingredient in mushrooms. MDMA is another. There's also work being done with LSD, with ibogaine, which is the active ingredient in iboga. There is lots happening with this class of medication and its application to mental well-being, to increase performance, and to healing. Something to pay attention to if you don't know already. But I thought it would be important today to talk about MDMA-supported psychotherapy because it looks like it is going to be one of the first ones to be widely rolled out outside of research laboratories. It will be one of the first ones that is sort of available to the general public. MDMA is a synthetic medication. It's something that is created in a lab. It does mimic some naturally occurring substances like sassafras. The MDMA that we've come to know and use in psychedelic-supported psychotherapy was discovered by Alexander Shulgin, who almost immediately saw its clinical utility and gave it to psychologists, psychotherapists, mental health professionals to begin using in therapy. The reason that Alexander Shulgin thought that this was a great tool for therapy is because MDMA is something that we call an entactogen. It floods the system with empathy. It really makes people feel soft and safe and connected to themselves, to the people around them. And it seems to really accelerate the therapeutic process for people who are working through a myriad of challenges, whether that's early childhood trauma, a sense of lostness or existential crisis in their current life, difficulty with their partner. MDMA-supported psychotherapy looks like it's going to be really, really helpful, revolutionary to couples work. A lot of good clinical work was happening right after MDMA was discovered, but unfortunately the FDA recategorized MDMA, forcing it to go underground. More recently, in the last 15 to 20 years, there's been a resurgence in interest in research with MDMA, particularly for its ability to help treat those who've experienced long-term PTSD, or post-traumatic stress disorder. So there is research happening with MDMA-supported psychotherapy in something like 80 medical schools around the country. So this is no longer kind of fringe science. This is no longer word of mouth treatment. Some of the best and brightest minds in human flourishing are focused on how MDMA-supported psychotherapy can bring about a change in the tide of the mental health crisis we now find ourselves in. So MDMA is a really ideal substance to be paired with psychotherapy because it is an entactogen. It floods the system with empathy, with a softness, with a sense of self-compassion. And this is extraordinarily helpful in moving forward the therapeutic process, especially when someone has had some kind of trauma. When we have an experience of trauma, either as children or adults, we tend to have places in our inner world, in our memories, in our sort of internal processes where it feels really scary or unsafe to go. So these are the things that we don't talk about, the secrets we don't tell, the things that have happened to us or around us that are so wrapped in shame or fear that it's almost impossible to speak them aloud. MDMA softens that. Physiologically, it inhibits temporarily the functioning of the amygdala, which is the fear center of the brain. So it makes us less afraid while also flooding our system with increased levels of serotonin and oxytocin, which are neurotransmitters that help us to feel a sense of calm, empathy, safety, well-being, happiness, pleasure. So that combined effect of decreased fear, increased sense of hopefulness and connection, make it a really lovely condition for someone to process more difficult, challenging parts of their experience. So MDMA supported psychotherapy is not just taking the medicine and going your merry way. It is an integrated process where a patient sits with a clinician. They've done some preparation work with a clinician up to the point of having an MDMA supported session where they are, while under the influence of the medicine, talking with their clinician, working through challenges, maybe going inside and recognizing a new perspective on memories that they'd held in a certain way. And then it's the role of that clinician in partnership with the client to process that session and to sort of unpack its implications after the session is over. So it is not just, hey, take this medicine and all things will be well. It really is an integrated process where psychotherapy is accelerated. Someone's capacity to be self-reflective, someone's self-compassion, someone's understanding of their relationship dynamics or how they maybe contribute to the problems that they're having in their life, or a path forward out of their own history of trauma. All of those things happen in a pretty accelerated but highly supported time frame. I think this form of treatment is really exciting because it is I think it is actually the first thing that the FDA is assessing that is a combination of medication and psychotherapy. It is the ultimate kind of mind-body treatment. It's relational. Someone who's going through this process is interacting with a therapist. They're not doing it by themselves. They're not just in a dark room with medicine. Like, they are having an interactive therapeutic process. But that is enhanced by a biochemical experience. So there is a medicine, something that's happening in their bodies. And if you follow my work at all, you know that I have a deep appreciation for the mind-body integrative part of mental health care, that our thoughts, our feelings don't just live in our head. They are a full body experience. So MDMA-supported psychotherapy is a nod toward that, toward acknowledging that all parts of our body and our being are involved in our healing experience. As I mentioned, quite a lot of very formal research is going into this work. Well, it would be impossible in one YouTube episode to tell you all about the research that's happening related to MDMA. But suffice to say that MDMA for trauma-related challenges is likely to be kind of the leader in the conversation of psychedelic-supported psychotherapy as it gets rolled out in the general public. I started hearing about this form of therapy as a postdoctoral fellow at the National Center for PTSD in Boston. And this is one of the leading centers of PTSD treatment in the world. And we've long known in the PTSD field, in the trauma-related field, that there are just some experiences that seem really difficult to access through talk therapy alone. Like, they seem to live in corners of our brain or parts of our body that are hard to get at just with words. And so MDMA-supported psychotherapy seems to be able to bridge some of those gaps and help people reintegrate some of their difficult experiences. My academic interest in this subject was deepened after I lost my own brother traumatically, and I found myself in a sense of deep grief and also experiencing some of the trauma-related despair that I'd been treating in other people for 15 years. So thankfully was able to access MDMA-supported psychotherapy and have found it to be an absolute game changer in my own healing and well-being. And so I've become an advocate, not just because it's clinically indicated, because I've had a personal experience of how effective this healing modality can be. I think it's so important for leaders and entrepreneurs to know about this because often you are the innovators. We are the early adopters. As wonderful as it is to be on the early phase of something, there are also a few things that you want to watch out for or be careful of. Because there's so much enthusiasm about this form of treatment, there can be, I guess, variable levels of quality of the people who are currently offering this treatment. Because it is not yet legal and not yet approved under the FDA, it's not yet part of the sort of healthcare system. There are folks in the underground who are offering this option, but may not have the kinds of qualifications that you would want someone to have in order to walk you through a fairly in-depth and vulnerable process. When MDMA-supported psychotherapy gets approved by the FDA, which I think will happen, or it looks like will happen happen as early as later this year in 2023, perhaps early 2024. The treatment is going to go through all of the growing pains of what it looks like for huge government regulation to now be involved in the rollout of a new innovation. And so I think it's going to be a little bumpy for a while. It's going to be uneven in how people can access this therapy. It's going to be uneven in how quickly people can train to offer this form of therapy. Like all innovation, it probably will go through several iterations before people figure out the right fit for it to be widely offered to the general population. If this is something that is really interesting to you, I would refer you to the MAPS website. MAPS is the Multidisciplinary Association for Psychedelic Studies. They are one of the leaders in this research process. Also happy to answer questions in the comments. If you want to drop those there at the end of this video, I'll do my best to weigh in on what I know as someone who has trained with MAPS and who has really pursued as much knowledge as possible around how this therapy can be most efficacious to entrepreneurs and leaders like yourself, like myself, who might be in need of both healing and also just optimizing our ability to be whole and well humans in the world. So there's a lot of utility here, a lot of excitement in this new innovation, and I hope that you will keep in touch and we can follow along together as things develop. Thanks so much for subscribing to the channel. Please share this video if you think it would be helpful to someone in your world, and leave me some questions and comments and we can continue the conversation there. Thanks so much.